So, IV insertion. So I'm going to check the medical order. I'm going to gather my supplies, which is a 22 gauge catheter, an IV start kit, a flush, a hep lock, and a pen. I would also be prepared with additional 2x2s and gloves. So I'm going to knock on the door, perform hand hygiene, introduce myself, ask my client for their name and date of birth, ask if they have any allergies, especially to latex, iodine, or shellfish. I would ensure privacy, ask if they're comfortable, if they're having any pain, and I would medicate them if necessary. Then I would raise the bed, lower the rail, put them in either a dorsal recumbent or a semi-Fowler's position depending on their hydration status. As I would get my equipment ready to go. So I'm going to open my IV start kit. I'm going to open my tegaderm. Clean a section of my table. Get some tape ready to go for after I get the catheter inserted. Prime my hep lock, keeping it as sterile as possible. Loosen that a little bit. Open my IV catheter. Then I would put on gloves. Put a Chuck's pad underneath, and then I would start assessing my arm. I would start by assessing a pulse, and for adequate circulation, I would avoid a site with a mastectomy, stroke, or fistula. I would try to choose a site on the non-dominant arm or choose a site that the provider has ordered for a particular procedure. I'm going to put my tourniquet 4 to 6 inches above my intended insertion site. Then I'm going to assess for an optimal site that has a straight line. I try and avoid the antecubital if I can do that. I'm going to go right here, which is just below, and then I'm going to remove my tourniquet. I'm going to take my first alcohol pad and go horizontally. I'm going to clean a big area in case I decide to go a different site than I originally intended. Then I would go vertically. Then I would take my chlorhexidine, kind of go side to side, vertically, in a circle for about 30 seconds. I would allow the site to dry completely and not repalpate the site that I cleaned. Then I would reapply my tourniquet, check for a pulse to ensure that it's still, I have adequate circulation. I'm going to grab my IV catheter, do the double OK method, and I'm going to pull down, go at a 10 to 30 degree angle, and insert. I would get blood return, advance my catheter, put on my tegaderm, release my tourniquet, grab my hep lock, and hold pressure so the client doesn't bleed, and then attach my hep lock to the site. Would then flush with 3 to 5 mils of fluid with saline, assessing the site for any redness, swelling, or pain. Then remove my tegaderm, take my tape, and stabilize. I want to make sure that I am not taping over my insertion site. Then I would do the date, time, gauge, and my initials. And I would put this on a site that does not obstruct the view of my insertion site. I would then put all of my trash in the appropriate receptacle. Take off my gloves, lower my bed, raise my rail, get my client in a comfortable position, ensure they have their call light, ask if they need anything before I go, and then I would document that I inserted a 22 gauge IV catheter by 1 inch at 1 attempt. Patient denied any pain before, during, and after the procedure. Patient educated that they are to report any signs of pain, erythema, or swelling at the site immediately. Then I would receive an order to remove the IV catheter. So I'm going to need a 2x2, tape, and gloves. I'd knock on the door, perform hand hygiene, introduce myself, identify my client, explain the procedure. We're going to remove that IV catheter out of your left forearm. Then I would put on gloves, clean a spot on my table, get a piece of tape ready to go, open my 2x2, then I would remove my tape in the direction of hair growth using an alcohol prep pad if necessary. Get my 2x2 ready, pull straight out, look at my catheter tip for integrity, and then dispose of appropriately. I would then ensure that hemostasis occurred and put on a sterile dressing. I would document that I removed a 22 gauge peripheral IV 1 inch from the client's left forearm. Client denied any pain at the site. There was no erythema or drainage noted. And then I would take off my gloves, perform hand hygiene. And that's the end of that procedure.